This is a problem that's been around probably forever. We probably have a much greater awareness of it, just as our own awareness of life around us has increased with media and the science around alcohol and alcoholism, the science of adolescent behavior. So we're probably much more sophisticated in our knowledge, but alcohol abuse on college campuses and among adolescents is hardly new.
I always say at our school, despite everybody really caring about each other and really, loving one another and wanting to see each other succeed, having a pretty collaborative environment, there's that culture of, you can do one more shot, you can take one more shot, when really that person probably shouldn't. And sort of changing that culture to people maybe just think one step back, just be a little bit more responsible, a little bit more proactive in other people's health and well-being, and we can go a long way towards making everybody a lot safer.
What we're just beginning to, I think, understand better is to collect the data to see what are triggers, what are differences that we can make. It feels like an intractable problem when you look at the macro level, but there are small wins along the way, and I think that's what we're trying to figure out, is how can you capitalize on those small wins and build on them across a broad system to affect substantial change. This constant improvement process, which, as I said, is sort of inherent in the medical profession, but bringing it to a social issue has been particularly interesting.
We can appeal to the smart, research-based, empirical side of everyone's minds by just informing as best we can and showing them that they are the ones who should be responsible for all their friends, and instilling a sense of responsibility in each person, that we all need to be looking out for not only ourselves but for all those people around us, because we're all in this together. I think every one of us, nobody wants to see one of their classmates die before we get to walk senior year. Nobody wants to sit and think about someone who died in an alcohol-related death that they could have stopped. I think it's something that everybody can have a stake in. It's something that everybody does have a stake in, simply because it's their friends too.